Hi, my name is Jessica, and today I'm going to be going through a range of motion with shoulder flexion, and I have my client Carter, who is already in the supine position on the table. And for shoulder flexion, I'm going to first have him flex his shoulder as far back as he can. Okay. And then the access point is going to be on the greater tubercle of the humerus. And that's right here. And then the movement arm is going to be along the lateral epicondyle of the arm. And then the stationary arm is going to be along the mid-axillary line of the thorax. And I will go ahead and take the measurement. And his range of motion for shoulder flexion is at 176. Next, I will be testing the range of motion for shoulder abduction for my client Carter, who's in the supine position. And then I'm going to move out of the frame and have him fully abduct his shoulder as far as he can. Okay, and then for this, my axis is going to be the anterior acromion, which would be right here. And then my movement arm is going to be along the medial epicondyle, which is here. Which is there. And then my stationary arm is going to be parallel with his sternum. So I will go ahead and take the measurement. Okay, and his range of motion for shoulder abduction is at 175. Next, we will be testing the range of motion for elbow flexion. And my client Carter is in the supine position. I'm going to place this as a towel under his elbow, like that. And then I'm going to have him flex his elbow as far as he can. Okay, and my access point for this measurement is going to be the lateral epicondyle, which is here. And then my movement arm is going to be the radial styloid process, which is here. And then my stationary arm is going to be the acromion process, which is here. And I'm going to go ahead and take that measurement. And he is at 139 degrees of elbow flexion. Now we will be doing manual muscle testing for shoulder flexion. I have Carter seated on the table, and I will first start off by talking about the end range and how I know I've reached it. I'm going to have him flex his shoulder while I palpate that region. And then once we get to this point, there's a firm end feel, and that's how I know that I've reached the end of range for the manual muscle testing. And then in terms of the compensatory area, it would be the superior aspect of the shoulder, which is the area that I will stabilize. And then he will flex his shoulder at a 90-degree angle, and I will apply resistance to the distal part of the humerus while stabilizing the superior aspect of the shoulder. And he would get a score of a 5 since he was able to resist my force. For the next manual muscle testing for shoulder flexion, it will be done in a gravity minimized environment. And I have my client Carter lying on his side for this one. And I will come back here And then I will palpate his anterior deltoid, which is right here. And then I'm going to stabilize his elbow and forearm, and I will take the weight of those regions as he flexes his shoulder and gravity minimized. And that would be a score of a 2 since he was able to go the full range of motion and gravity minimized. So the next manual muscle test will be for shoulder abduction against gravity, and Carter is here in a seated position for this test. So before we start, I will determine the end range or the end feel of shoulder abduction. And so I will palpate the superior aspect of the shoulder, and he will abduct his shoulder. And right at this point, this is how I know I've reached the end range, as his shoulder has a firm end feel to it. And for this test specifically, I will be stabilizing the superior aspect of the shoulder, since that is the area that is most likely to compensate. And then I will apply resistance to the distal humerus, and he will have his shoulder abducted to 90 degrees. And then I will apply resistance. And that would be a score of a 5 since he didn't break and was able to hold his position. For the next manual muscle testing, it will be done in a gravity minimized environment for shoulder abduction. And for this test, Carter will be lying supine. And I'm going to come in and stabilize the superior aspect of his shoulder, and that is the compensatory area. And by me stabilizing it, it will prevent elevation from the shoulder as he abducts. And I'm going to have him abduct his shoulder. And that would be a score of a 2 since he was able to go his full range of motion and there was no compensation from the superior aspect of his shoulder. For this next manual muscle testing, it will be done against gravity for elbow flexion. And before we get started, I am going to determine the end range for elbow flexion, and Carter will be in a seated position for this test. And I will go ahead and palpate the superior aspect of his shoulder right here. And then he's going to flex his elbow. And then right here we have a hard end feel, which indicates the end range for elbow flexion. And then for the test, I will be stabilizing the anterosuperior aspect of his shoulder. And by stabilizing this region, I will be avoiding any compensation from that area during the manual muscle test. And then I will also be applying resistance to the distal part of his forearm, which is right here. And then, so first he's going to have his elbow flexed like that, and then he will come at 20 degrees, and this is where I start applying the resistance. And since he didn't break and was able to maintain his position, that would be a score of 5. So for the next manual muscle test, it will be done in a gravity minimized environment for elbow flexion. And my client Carter is seated for this one, and his arm is resting on the table. And then I will come back here. And then I will stabilize the anterior humerus to avoid any sort of compensation from that region. And then his shoulder is abducted at 90 degrees with his elbow slightly flexed. And then I will be palpating his biceps brachii for a contraction, and as he flexes his elbow. And that would be a score of a 2 since I felt the contraction in his biceps brachii and he was able to go the full range of motion.